let's review the setup for the endoscopic portion of your case. This is actually pretty straightforward. You'll need your endoscopy tower with suction, irrigation, and CO2 connected and functioning. After that, you're going to have to decide what type of scope you're going to be using. If you're going to be delivering the magnet to either the antrum or to the proximal duodenum, then a gastroscope is sufficient. In cases where the magnet will be delivered distal to D1, anywhere close to the ligament of Treitz, you're going to go ahead and choose your pediatric colonoscope. Following that, you're going to make sure that you have your delivery system, your magnet, and please make sure that in cases where the magnet was swallowed by the patient, the first magnet was swallowed by the patient, that the appropriate size is confirmed and verified prior to loading up the magnet. Finally, in cases where the magnet will be delivered to the ligament of Treitz, I usually will prepare 20 cc syringes ahead of time, and this will be injected after deploying the magnet. And the best way to do it is to connect it to a plastic catheter that will make it easy to inject the mineral oil through the working channel, and you can follow that with water after. So if you have two screens, then you can easily stand on the head of the bed or to the side because you can keep one screen in front of you and one to the left. However, if you only have one screen, which is usually the one that's connected to your tower, then you want to keep your tower on your left-hand side and you want to really stay at the head of the table because if you do stay on the right side, you'll end up twisting too much. The other thing is, once you're standing on the head of the table and you are looking at your left screen, you don't need to do a lot of movement. So you're really just using the scope or torquing to direct your magnet where you need it to go. Now I have my magnet attached and I want to insert it. The easiest way I find is that if I keep my hand on the dial and allow for a C curve to stay like that, I will put in the magnet wherever I need it to be. I'm keeping this on the outside just so that you can see what's happening. And with my left hand on the actual scope handle, I will turn the left without, and as you can see, my right hand is not doing much. It's just making sure that it stays in the center. All I'm doing is turning it to the left. This makes it almost like a bougie insertion rather than me trying to direct it under visualization. If you get stuck at this level, all you want to do is ask your anesthesiologist to give you a little jaw thrust, and that will usually help you pass through. So what I'll do is I'll keep my scope on my shoulder and that will free up my hand. As you remember, we're keeping the 2 centimeter distance. I will use my free hand to guide the magnet through. And with my left hand, I will place it inside the mouth, pull on the teeth so that I can give myself a little jaw thrust. Your magnet and scope will usually stay in place. At that point, you can use the right hand to torque and push as you go through. And once you're past, remember that if your surgeon does not have a clamp on the intestines, you want to keep your insufflation at minimal as much as you can. Usually when I'm working, if my catheter is attached or it's on my hand, I will only advise my assistant once I'm ready and I'll give them the catheter to go ahead. If they are with me from the beginning, you can keep your assistant and ask them to hold on to the catheter, make sure that they're holding it from the ring and only hold on to the blue to release when you are ready. Okay, so let's say that you try to release and the magnet is not releasing. What are you going to do next? The first thing you want to look at is your scope. Do you have any loops? If so, try to straighten your scope up. You can send your loop into the actual cord, and you can make sure that if you are using a pediatric colonoscope, to just add a little bit more stiffness. If that still didn't work, then you can simply torque at the mouth, and that will allow the magnet to turn and release. I want to demonstrate what happens when you are coiled. So as you can see, I'm coiling here intentionally and the magnet is there. I'm pressing on the blue and nothing is happening. The second I will straighten out my scope, usually that will allow it to work, just like that. All right, let's say that we straightened and we torqued and nothing is working. Your assistant is holding on to the catheter and nothing is letting go. What you want to do is simply pull the catheter back into your working channel as you are pushing the magnet through and give it time, straighten again, and that will release.
Let's take a look at the distance of the catheter. When the catheter is too far away, it can easily retroflex. However, if your catheter is too close up onto your scope, what ends up happening is that you get caught onto tissues without realizing it, and that will bend the catheter at the level of its attachment.
Let me show you why that's a problem. If you pull the catheter back into the channel, you might be faced with some resistance as it is not straight. If you actually try to release the magnet, the mechanism will fail to let go, as you can see in this part of the video. To fix that, you need to pull the catheter back into your channel, maintaining a constant gentle tug or pressure while you're pressing the release button, which will help straighten the tip and allow for the release of the magnet.
If you're still at the beginning of the case, you can also withdraw your scope with the magnet and try to straighten up that catheter on a table, but make sure that you do test the mechanism a couple of times, connecting and releasing the magnet to make sure that it's still functioning properly.
To reposition a detached magnet, you can use the tip of the catheter as it is magnetic to guide the magnet to another location. Once it is in place, you can simply pull the catheter back into your channel to release it. And please note that this technique should not be used to dock the magnets, as the catheter might get caught in between the two magnets, which might cause injury to the tissue as you're trying to pull it back into your scope.
Another alternative to withdraw the magnet, the scope itself can be used by bringing it adjacent to the magnet, which will then stick to the side, as you can see here.